Good afternoon. My name is Carl Cooper. I'm the Director of Public Health Programs at the American Association on Health and Disability, and we want to welcome you to our Facebook Live event today, Getting the Most Out of Your Health Insurance. And today we really want to focus on coverage in mental health and making sure that you're getting the most out of your mental health coverage and benefits that are available in insurance plans. The Affordable Care Act required every plan to have 10 essential health benefits, and one of those is mental health. And we want to make sure that people are able to get the most out of that coverage so that they can access the services they need. This is the second in our series of Facebook Live events that we are doing. Specifically, this is a series on getting the most out of your health insurance. Last week, we talked with someone about rehabilitation and habilitation benefits. That is archived both on our Facebook page and on our YouTube channel if you want to check those out. I would encourage you to do that. And likewise, this particular session will also be archived on our YouTube channel afterwards, probably within a day or so that you can check those out if you want to view this after the fact. But for now, we want to welcome our guest today. Andrea is going to join us and tell us a little bit about her coverage and getting the most out of her coverage as it relates to mental health. So Andrea, welcome. Why don't you go ahead and do an introduction, tell us a little bit about yourself, and tell us where you're at and where you're from.
Hi, my name is Andrea Ellis. My pronouns are she, her, ella. I am a student at the University of Houston studying political science. I am in the Young Advocates program at Young Invincibles. We are a national nonprofit whose mission is to amplify the voices of young adults in the political process and expand economic opportunity for our generation.
Okay, great. In terms of your health insurance, where do you have your coverage through, and what type of coverage is it?
I currently have private insurance through the marketplace. I have been uninsured and I have been insured through my work before. As a DACA recipient, I did not qualify for Medicaid, even though I paid taxes. I believe that access to healthcare is a human right, not just an American one.
I couldn't agree more. As far as your health insurance, what do you rely on your health insurance for? What are some of the main areas that you utilize your insurance?
I rely on health insurance for access to mental health and preventative care services such as therapy, prescription drugs, and regular checkups.
Okay. And in terms of the mental health treatment specifically, and you can get into as much detail as you feel comfortable. I don't want to press you to talk about things that you don't want to talk about. But in terms of your mental health treatment, what sort of treatment do you have you utilized with your health insurance?
Through my insurance, telehealth is covered 100%. So I'm able to schedule telehealth therapy appointments. Right now I'm seeing my therapist twice a week and my psychiatrist once a month, just to make sure that my medications are going well with everything that we're doing.
Now, is the telehealth something that you utilized before COVID, or is that something that's been more recent?
It's been more recent. I think I can count on one hand the amount of times that I've used telehealth before COVID. I didn't actually know that it was a thing. And it's very useful, specifically when you're dealing with something as hard as depression and anxiety. Some days I don't have the energy to get out of bed. Some days my anxiety gets the best of me. And on those days, I can set up an appointment if it's an emergency, or if I have an appointment, I don't even have to get out of bed. I can't count on how many times I've done an appointment while I'm in bed, just like feeling the weight of the world on me.
So it sounds like it's really opened up access then to the option of telehealth.
It has.
Yeah. What would you do if you didn't have insurance?
For the past 5-6 years, I battled depression and anxiety on my own. I was diagnosed with major depressive disorder when I was 18. And through Title IV, I had access to it, to healthcare with Harris Health. After I turned 18, it was harder because we transitioned to as an adult care, and it was just very hard because the wait times were longer. They only had 2 therapists on staff, so it was really hard to get a time in. So I just stopped going. And because I didn't have access to anything else, I completely stopped any sort of treatment. And it was really hard.
Mm-hmm. So how long have you had the current insurance that you have now?
2 years. I got it just after COVID or the lockdowns began.
Okay. All right. And have you experienced any issues when utilizing your insurance plans, specifically problem with finding providers within your network or getting access to appointments or anything like that?
Well, I personally haven't had any issues with my insurance plan. I know others might. I'm the kind of person who takes initiative, and when I finally became insured, I tinkered around with the website. They don't make it easy to find information. It's really hard, and unless you're technologically savvy, things get confusing. I was able to find how to search for an in-network primary doctor, a dermatologist, a dentist, an optometrist, to see which urgent care was covered under my insurance, and an OBGYN covered by my insurance as well. On the website, I was able to read through my schedule of benefits where it details my annual deductible, the co-insurance, the out-of-pocket maximum. It also lists what I have to pay when I see my primary care provider or a specialist, how much my prescriptions cost, and what services are covered. For those who aren't technologically savvy, all this information can be and more is available to you by calling the 1-800 number on the back of your insurance card.
Okay. Anything else in terms of, I know that especially with mental health, lots of times people encounter problems with, providers not seeing new patients or anything like that. Have you ever experienced any of those kind of issues?
No. Like I said, when I tinkered around with the website, there's a lot of ways that you can filter out. So you can filter out by zip code, what language they speak, whether it's a male or female doctor. Are they seeing new patients? Do they see people on the weekends or after normal hours? So figuring out the filters, I was able to find the correct doctor for me.
Okay. And this was your insurance company's website?
Mm-hmm.
Okay. And in terms of stuff that people that might be dealing with similar issues, any tricks or anything that you think of that you could suggest to people if they're struggling with finding access to providers or anything like that?
Like I said, a lot of this information, if you can't find it on your own, by calling the 1-800 number, they're able to help you a lot. On my own, I was able to find out that my insurance covers Amazon Pharmacy. So I get my prescriptions delivered to my home, and Amazon will send me a monthly reminder, hey, you're about to be out of your medication. Do you want to put in an order? Or it's time to do refills, so they have to call my doctor to make sure that I'm getting the right one. And it's delivered directly to my home, so it's a lot easier.
Mm-hmm. What about in terms of your coverage that you have now? Would there be anything that you would suggest to folks that maybe don't have coverage, that are struggling with mental health issues, and what you could counsel them in terms of how much it's made a difference in your life and what you would do if you were in their shoes?
If you have the ability to get insurance, go on Marketplace. Look to see if you qualify for the credit to be able to pay less, because it's very beneficial. There's a lot of things that are available to you if you have insurance. If you are not able to get insurance, you can go to a local library and use their computers if you don't have one yourself, and look for community health centers. More often than not, their wait times will be a little longer since they are servicing a lot more people, but they will be able to see you, and you probably won't need to pay anything for it. And if you do, it will be a very minimum payment.
Okay. Let's change the topic for a second and talk about a little bit about your work with Young Invincibles. I know that's an organization that we've done work with in the past, as far as a lot of the outreach that we've done on the Affordable Care Act and Medicaid enrollment. Is there anything specific that they have going on that you'd like to highlight that you want people to know about?
Yes, we are currently doing virtual storytelling circles about mental health. So for anybody struggling with it, for anybody struggling with access to healthcare, you can go to our website, younginvincibles.org, and there you will be able to find information on how to participate. I know that it's a very trying time, so being able to talk to people who go through the same things you do and seeing that you're not alone helps a lot.
Okay. And that sounds fantastic. And we'll try to get that information as well. And we can maybe put that in the chat feature after this. So if people are watching this after the fact, check that out. And by all means, let us know if there are other opportunities that you're aware of that people can get plugged in, because I know this is especially mental health is an area that I think a lot of people maybe have gotten, I shouldn't say know about, but they've come to recognize more, especially as we've gone through the pandemic over the last 2 years and how it has affected people's mental health. And we want to make sure always that people are taking care of themselves and taking care of their mental health. I know that I think you raised a real good point with the telehealth specifically and how that can be such a benefit to that population. I know that's also true for people with mobility disabilities. Many times it's a difficulty getting to a provider, and utilizing those kind of things, I think, is also a great reminder of taking advantage of these things that many times, providers and insurance companies will allow. Now that we've gone through the pandemic, they are willing to do a lot more of that stuff now. So let's make sure we're taking advantage of that to the degree we can. Andrea, I really want to thank you for joining us today. I think this has been super helpful, and I really hope that people are able to get the information that they need. I do also want to point out, I think we've just added in the link in the comments, by the way, about the Story Hub for Young Invincibles. So please, by all means, check that out if you have the opportunity to. If you're interested in finding out more about that and sharing your personal story, I would really encourage people to go ahead and do that. So with that in mind, I want to once again thank you for joining us today, Andrea, and we'll look forward to working with your organization again.
Thank you so much. It's always a pleasure to be able to speak out about something that's so important to me.
Great. So want to thank Andrea, and want to thank all of you who were able to join us today. Like I said, this is the second in this series that we're doing. Please check out the one we did on rehabilitation and habilitation last week. This particular stream will be archived on our YouTube page by tomorrow at the latest. And we will also have another session next week. We'll be talking with someone about medical devices and accessing medical devices through their insurance company. That will be next Wednesday at 3 p.m. So please join us on Facebook for that. But for now, we want to thank you all for joining us today, and we hope you can get the most out of your health insurance. Thank you.